I am Dr.C.Rex, Head of the Department of Orthopedics from Rex Ortho Hospital, Coimbatore. Today we are here to launch the robotic knee replacement system. And for last 20 years, we have been doing the conventional total knee replacement, which is nothing but replacing the whole knee joint with the artificial joint. And if you see in last 20 years, I have performed more than 10,000 joint replacements, both in hips and knees, and we achieved almost 95 to 96% success rate. But if you see in India, the commonest problem is osteoarthritis of the knee, which is nothing but you can see many people walking with the bow leg or difficulty in walking after the age of 50, 55. And the incidence is very common. 1 out of 5 person after the age of 60, they suffer from arthritis of the knee. Not that everybody needs surgery, but at the terminal state of arthritis, once you go to a stage where you feel very difficult to walk even 100 yards, or the day-to-day life becomes a problem, or to perform their normal duty or get back to the work becomes tough, then after exhausting all the medications, physiotherapy and all the other conservative means of treatment, then you consider knee replacement. Knee replacement is a wonderful procedure, but if you see recently, we are aiming for a success rate of 99 to 100%, and this can be achieved with the new advent of robotic knee replacement, and which is a boon for the orthopedic society, and this is another additional value addition for the armamentarium of the orthopedics, and is a bliss for all the severe arthritic patients. And if you see the advantage of robotic knee replacement, it is a quick procedure and we can do it more accurate, almost I would say 100% accuracy, and precision is almost to the nanometers, nanomillimeters. That means it is a very less, you take the bone very less. That means only whatever required to make it more architectural and perfect, the robo is going to take. So it's almost, I would say, you are resurfacing the joint, removing the cartilage or the lost bone, only you try to replace. No additional bones or the ligaments or nothing is being removed from your body. So it's something like to mimic the normal natural knee, you are going to replace with a new knee. So this is possible only because of the robotic joint replacement. So the accuracy is very precise, and it takes very minimal bone from the patient for resurfacing, and it calculates all these to the utmost care to match the patient's shape and size, which will vary from patient to patient. And also if you see, most of the severe arthritis, they have a severe deformity. They have too much of bow leg or knock knees, and these will be corrected to the perfection. And the other thing which I like to say is the robotic knee replacement is going to take over in another 15-20 years time, and all the joint replacements will be done only with the help of robotics. And the fully automatic robotic knee replacement, this is the first time we are getting it in Tamil Nadu, and this is going to be really a boon for all the patients of this part of the country, and all can benefit by taking the advantage of this new robotic system. When everybody talks about robotics, they think all done by robotics. It is not true. The surgeon plays a major part. He only designs or templates how the procedure need to be done. So the planning will be done by the surgeon by assessing the scan of the patient, looking at his X-rays, the CT scans, and 3-dimensionally he will plan what need to be done, and the execution will be done under the supervision of the surgeon by the robo. So the robo does the procedure under the supervision of a senior surgeon. So this is going to make it like icing on a cake, so that it is both the ways. You have experienced a senior surgeon as well as you have a robo to get the best out of both. So, this is the win-win scenario. And the other thing is, if you look at the cost factor, everybody knows that that with the technology you have to pay more. It is true, but in a large volume center like us, where we do simultaneous joints in same both knees replaced at the same time, and we tend to do 4 to 5 joints a day, the cost cut down can be possible, and we try to don't tax the patient too much. Only with the minimal the cost we can do the best robotic surgery. So, that is the that is really possible because of the large volume which we do. So, it is not that occasional surgery, so it costs more. So, with the large volume, definitely the price factor also comes down a lot. So, my motto is this: the technology should reach to the common man, and this is possible only in a centers like us, where we can do the best possible the surgery with the robotics, and also the time taken for healing of the wound also is very less. The rehabilitation becomes quicker, and the stay in the hospital becomes very less, and the patient can get back to the work maybe at the end of 2 or 3 weeks time. So, such a quick faster recovery is possible only with the robotic surgery, and I am sure all the patients who needs this sort of procedure will benefit from this new technology, and please embrace this technology whenever you want, and make sure that you get the best in the world with the state of art surgery and technology. So, thank you everyone.